Hello, it's Dr. Hall. We're talking about 7 tips to help you better manage kidney disease in primary care. I, I'm a nephrologist. I've been practicing nephrology for about 20 years. Just I've tried to do this video probably 4 times. The lights went out. The internet stopped working. The internet got slow. The signal was lost. It was just crazy. But the first time I did it, the audio was on mute, so I had to redo it. So I'm gonna try it again. First thing you need to do when you're a patient with kidney disease come to your clinic is check a good history and physical and family history. History and physical can give you great information about what's going on in the patient's past. Also, was their granddad on dialysis or uncle or something like that. So these are great things that you can do to find out past history because it is so relevant to your patients. Number two, if your patient is diabetic, always check a hemoglobin A1C. That kind of goes without saying, but I just want to say it because that's one of the main ways to know if your patient's diabetes is well controlled or not. It's only accurate if you check it every 3 months. If you check it every month or every 2 months, it's not accurate. Why? Because red blood cells have a half-life of about 3 months. So when you're checking those glycosylated red blood cells, which is what hemoglobin A1C is, glycosylated red blood cells, they die about every 90 days, red blood cells, or they, I guess, reset, so to speak. So you always want to recheck the hemoglobin A1C about every 3 months to get an accurate picture of what their sugars are doing. If they're hypertensive, check blood pressure, make sure it's below 130/80. You guys know that, but my approach is to try to get it as low as we can because blood pressure is the second most common cause of kidney disease, second to diabetes. The fourth thing is medications. Polypharmacy is rampant amongst CKD patients. They are on 8 to 10 medications, and we always try to minimize medications because of side effects, um, cost, convenience. So just, if you have a patient on one blood pressure medicine and their pressure is not controlled, always try to optimize that medication before adding another medication. Fifth thing, labs. Always check labs. CMP, comprehensive metabolic panel. You always want to check your urinalysis. On the CMP, you look at the creatinine, the potassium, the sodium, the BUN. These kind of things can tell you this patient has kidney disease. The urinalysis can tell you if they got protein or not, if they got blood in the urine or not. The urine protein to creatinine ratio tells you quantitatively how much protein. And that is so vital to you as a primary provider and to us as nephrologists, knowing how much protein. Is it 100 milligrams, 500 milligrams, 1,000 milligrams? If it's greater than 3,000 milligrams, we usually do a kidney biopsy. So that urine to protein creatinine ratio on a spot urine sample tells you how much protein you're spilling in the urine in grams. That's an easy way to check urine protein without having to do a 24-hour urine. That's so cumbersome. You can check this in clinic, get it back in 24 hours, and you'll know if your patient has proteinuria or not. Number 6, other labs. We look for HIV, hepatitis, lupus, so we check those labs. HIV is the third most common cause of kidney disease amongst blacks aged 18 to 64. So in that demographic, we always check HIV antibody. Now, in young black females, lupus is very common. So we'll always check an ANA and look for autoimmune diseases in that demographic. Incidentally, prior to HIV in the 90s, lupus was the third most common cause of CKD. So HIV trumped lupus because of its effects on the glomeruli with HIV nephropathy. So always check HIV if you suspect your patients may have if they fit that demographic, or you suspect they may have some, I guess, alternative lifestyles, or you just think they may have HIV. And the last one is nephrology referral. Who should be referred to nephrology? Well, that's the $1,000,000 question, because you guys are on the front lines, and we know you see a lot of patients, and you guys are asked to manage nephrology related issues because you may not have nephrology coverage, you may not have good nephrology services in your area, and just knowing these things can help you better manage your patients even before they get to nephrology. We did a video below on our YouTube page about the 9 indications for nephrology referral. You can check that out. We've created a mini fellowship for primary care providers. It is for nurse practitioners, physician assistants, family med docs, and internal medicine docs. And this program is 7 modules with quizzes after each module, and it will help you just kind of get all the clinical information. You can have it at your fingertips on managing these CKD patients. Check us out below. Sign up for our webinar. We appreciate you tuning in. Thank you. We'll see you in the next video. Bye.